More medications, less health. Something's broken. Traditional medicine manages symptoms, but true healing addresses root cause. I'm Josh Rimini, pharmacist turned healer. At Beyond the Pills, we merge ancient wisdom with modern day science to inspire you through stories of transformation, practical trainings, and holistic healing. Join me and other practitioners as we guide you towards vibrant health, body, mind, and spirit, and move beyond symptom management into true healing. Welcome to this episode of Beyond the Pills, where ancient wisdom meets modern science to redefine what true healing looks like. I'm Josh Rimini, pharmacist turned healer, and today I am super honored. We have an awesome guest for us, Dr. Jeff Gross, who's a neurological surgeon. He graduated from UC Berkeley with a degree in biochemistry and molecular cell biology and earned his MD from George Washington University. Today's episode's super awesome. I'm excited for this. He went on to train in neurological surgery and spinal biomechanics. He now leads innovative practices in Orange County and Nevada, specializing in spine surgery, athletic injury, advanced longevity protocols. As the founder of ReCELLebrate, Dr. Gross is pioneering a new model of healing that offers cutting-edge treatments like NK cell-derived exosomes as a breakthrough and non-toxic cancer therapies and age-related disease prevention. If you have ever wondered what's next in this evolution of medicine, I believe this episode is going to be transformational for people. So welcome to the show, Dr. Jeff Gross.
Thank you so much for having me. Great to see you.
Yeah, let's dive in, because when we had our pre-recording conversation, I was just yes, because we've started to reveal these new therapies of healing with exosomes and stem cells and moving in this direction. And then when we connected, we really started diving in on what you've been doing with the cancer therapy. So I'm really excited for this episode. So thanks first and foremost for just coming on and sharing your mission here. But you had a pretty amazing and impressive medical journey. So let's start there. Like, what first drew you into like the neurosurgical stuff and then anti-aging, biohacking, and cancer therapies?
Well, I mean, I had always wanted to be a physician since I was young, since I was a child. I always took all the extra science classes in school, all the AP classes. In fact, to really demonstrate my total nerdiness, I used to take English in the summer, get it out of the way so I could make room for another AP science class. Like, that's how crazy I was in high school. And I was reading, all kinds of medical journals. And at that time, I actually did medical research at the National Institute of Health during one of the summers in high school. And I was all in, 2 feet, 2 hands, 2 everything. I was just in. So, college was all about molecular biology and biochemistry and, all the things I could learn that I know I would use. But really, where I went to school, there was no pre-med degree. You had to get a real degree.
Yeah.
To go to medical school. So I got the real degree and enjoyed that. And that comes full circle later. And medical school was a stepping stone. I knew I was going to go into neurosurgery. I knew I was going to be a surgeon, because when you're in medical school, there are 2 kinds of doctors, those that do and those that think about doing. The thinkers become internists or specialists in organ systems. The doers become surgeons. They want to actually do something, get their hands in there. In fact, the word surgery comes from the Greek, to make with your hand, right? So I knew neuroscience was of interest to me. I had some mentors in that field, and so I was headed to neurosurgery. Medical school was just something you had to get through to get there. And my residency, I really was interested in the brain, did a lot of brain research, published articles in research involving lasers in the brain and how to use lasers to detect tumors and stuff. In fact, our article on measurements intraoperatively in surgery, measuring the absorption characteristics of brain tissue and things, is been quoted like over 500 times or cited over 500 times because I think we were the first ones to measure that in live brains and the human brain. So I've got some cool background because I am a full-time nerd. So from there, went into practice. I added the spine fellowship at my very end of my residency because I really got interested in the spine and the physics and mechanics of the spine. And the vast majority of my practice was for many years, and still a little bit, was taking care of spine problems, neck and back issues, disc issues, nerve issues. It was because of my patients who noticed that they didn't respond to most of the conservative treatments, like therapies and injections and medications, I think, for the spine. They would come talk to me and would say, well, I guess the only thing left to talk about is surgery. And they'd say, well, wait a minute, I'm not that bad. I say, great, because I didn't want to offer it to you unless you had to have it. So they would say, but there's this big gap between all these things that didn't work and surgery. And I'd say, you're right. And they'd say, well, what about stem cells? What about this? What about that? And I heard stem cells enough times. And I did have the background in molecular biology that I said, let me go back and look at that. Let me open my mind. And I went back into it. I would start going to research meetings and educational conferences and retraining and learning what had happened in the 30 years or 35 years since undergraduate school, when I did study these things. And a lot had happened, most of it not here in the US, Josh. It was in Europe and in Asia. And we were just late to the party. So I said, let me start to offer this as an option to my patients, because one of the best jobs a physician can have is making sure we provide all the discussed options in a list of things. Let me add that. But it's blossomed into so much more. So that's why I call myself a recovering neurosurgeon, because I'm really doing more regenerative medicine and cutting edge alternative natural healing than I am surgery these days. And I love it. And I hope this just continues and blossoms.
I love these stories of healthcare practitioners or surgeons or doctors and pharmacists where they've got all this experience over here, and then a couple things happened, and then all of a sudden, like, their eyes were wide open. I love the fact that you were a dedicated surgeon working on spines, working on neurosurgeries, like, and still was listening to your patients, coming up with non-surgical opportunities, and really, and nurturing that knowledge that you wanted to bring. Because a lot of the times, I think people's perceptions of surgeons is you go to a surgeon, you get a consult, and what's he going to say? You need surgery, right? That's kind of like the mindset for people. Right. And so hearing a surgeon go towards not the other side, but opening up the possibilities and just really understanding where you came from as a physician to open up those possibilities. And then that door opened, and then you had to explore these things, because when we had our conversation prior, 10 years ago, stem cells was a very archaic thing around here, and my wife's journey through her, the reason I've gotten into this is because, PRP and stem cells, and my wife's torn labrum in her hips, and then going through 2 hip surgeries was like my first awakening to that. But back in the day, it was pretty medieval compared to where we are today, right? Like getting it, sourcing it, and moving it. I love that defining moment. It really was like a defining generative path, like exosomes. So amazing for you to just be there and smile and being like, I'm a recovering surgeon, because I'm a recovering pharmacist. The reason we're here is so we can move the needle towards these awesome healing modalities, and they truly are. So let's dive into that, like the science of the exosomes and what's going on here, because for the audience that may be new to this, just can you give them an overall what's over with exosomes, stem cells, regenerative therapies, just like a world view of that, because I think it is still pretty new, even though we're getting this accessibility, and we'll talk about your clinic, but
Right.
Tell people a little bit about what's going on right now, because
Well, it's not. This isn't new. We've been utilizing our stem cells unbeknownst to us forever. And just the basic stem cell 101 here is, a stem cell is a cell from which other cells are derived. It's sort of a parent cell. You think about, you're a fertilized egg inside your mother's womb. You're a stem cell. You can form a whole human. And then those cells divide. Those are called omnipotent stem cells because they can make a person. They divide and start to form parts of the body and limbs, and those are pluripotent. They can do a lot. They could form a limb, but not a whole human. So they become more specialized. And they grow and develop, and finally the fetus is ready to come out, and it's born with what we call um, multipotent stem cells. And those are stem cells that can be utilized when called upon to help us grow and develop as a child into an adult, help repair wounds. You cut yourself, there's a whole process there, help replace tissue. And we do that all the time, right? You're making new liver cells, you're making new skin cells, you're growing nail, which is a protein product from cells in the nail bed. Like, we're using our stem cells all the time. They're throughout our body in different tissues, mostly in the bone marrow. That's our most important source of them. And you've probably heard them over the last few decades because there's an approved treatment for childhood leukemia, whereby you give them chemotherapy, you remove their entire bone marrow, and you replace, called a bone marrow transplant, a matched donor of bone marrow, which is mainly stem cells. So that is why mothers have been saving their umbilical cords, banking them, and things like that for a long time. Well, it turns out there are way more uses of stem cells than that. Now, turns out that stem cells make signaling factors that transmit outside the cell to other cells in our body. We take them in through a process of endocytosis, if you remember that from high school biology. So the cells make a little bubble, and that's exocytosis, and they deliver a small bubble with a little bit of a membrane, like a cell, but many fewer receptors and proteins and markers. And inside of it are communicating peptides and proteins like growth factors and small RNAs that are taken in by another cell, and that cell is influenced. So how do cells communicate with each other? This is one of the main mechanisms. So one cell can give off thousands of these things a day. They're called extracellular vesicles. For the short, they're called exosomes. And you used that word earlier because it's the topic of regenerative medicine. Exosomes are doing the work. They're delivering the signal to cause your cells to do the right thing that they may have forgotten how to do, or have been bogged down by fighting inflammation and need a little encouragement to do it a better way. That's the whole basis of regenerative medicine, tapping back into that pristine biological signal from a stem cell and communicating that with our cells, so our cells act in a more restorative, youthful, regenerative way.
yeah, the way I've always understood it, or the way I kind of just to try to explain to it now is like, these are the key communication tools to tell the body what to do. Because on these episodes, this podcast, we're really teaching the body how to heal itself. The body knows what to do, but it doesn't always know exactly when and how to do it. Like these exosomes, these extracellular molecules, these things, they're signals. They're just signals in that
Right.
that move it down the pathway that for healing. And that's why I think this is so much of a game changer compared to, let's call, our traditional medicine model, where we're tinkering and fixing and trying to
Right.
help and influence. So you mentioned childhood leukemia. That is the cancer I had when I was 16 and got through. Was the chemotherapy, the radiation, the spinal taps, the chemo to the brain. Like, I did the 3.5 year, let's call it medieval therapy, kill everything, hope you live, and move forward. Like, you blast everything out. And so
Right.
these new therapies, And I wasn't a match at the time for these stem cell, these bone marrow transplants. But I love that you brought that full circle, because it was a treatment option for failure of chemotherapy. Was, can we do a bone marrow transplant? That in itself is a stem cell, right? It's a stem cell transplant, right? So we're working through that. We've known this for 20, 30, 40 years, but now we're moving it into this new paradigm, right? So I'm just curious. You're fixing, you're tinkering, you're doing surgeries, you're employing these stem cell therapies, and I assume the reason you keep doing them was you were getting really good results and outcomes, right? Or was it
Right.
the journey, right? You say you're a recovering surgeon, but like that was your whole life, and now we're moving into this new space. What's the aha here? Why this now?
I was never an aggressive surgeon, right? You had to be really at your wit's end for me to offer you surgery. They tell you in residency, you learn how to do the surgery. You learn how to operate. In practice, you learn how not to. And no one better than a surgeon to help people learn how to stay away from surgery, right? I mean, it's pretty barbaric what we sometimes do as surgeons. And now it's necessary in many cases, but what we're doing as surgeons has not changed in about 60 some years. So at least in the spine field, yeah, we can do it through a smaller incision or have a different widget or a microscope, but it's the same thing. So I was looking for something new and restorative because I never liked the destruction that was required in order to do surgery. Now, don't get me wrong, there's always a role somewhere for surgery. There's some nerve that's pinched by a large herniated disc that right now I don't have a solution for with regenerative medicine. So I saw someone the other day who's got stenosis in the cervical spine that I cannot offer him an option with regenerative medicine. I'm looking for, inflammatory pain and degeneration of the spine causing these issues where I can provide an option, and we are seeing some good results. I'm not allowed, as you know, to make any marketing claims that we're treating or curing a disease or condition, because the FDA, that's their language, and I want to be compliant with that language.
Right.
But a surgeon is never guaranteed the outcomes, so it's nothing new or different here.
And I think that's important, because we're not downplaying what's existing and what's been there. But like I said, like when we're doing our hormone restoration in the lab, like there's some new information and new technologies and new treatments, but we're not making claims, right? The FDA does not want us to make claims, and for good reason, but we are impacting lives in a very positive light. Give us a few examples of some histories of patients. Obviously, we're not going to say names and stuff, but tell us a little bit about what's possible right now.
Yeah. So I'm allowed to discuss actual observations and cases. So the low-hanging fruit in regenerative medicine, and the thing we've had the longest experience with, even if it's from other countries, is help with joints and inflamed, degenerating joints. So this is a process often referred to as osteoarthritis. Some people shorten that to arthritis, and that's just vague, but that's what they call it. Cartilage degeneration, and can be bad enough to what are sometimes referred to as bone on bone. And what happens then? Orthopedic surgeon recommends a joint replacement. We're trying to avoid all that, and we've been really good at doing that so far. But this is something where people come in with, oh, I had an old knee injury years ago in sports, maybe a knee scope, and my knee is really giving me trouble. It's stiff when I stand up after having been sitting. I have trouble going down the stairs. I can't play pickleball anymore. And then we do a very detailed evaluation for targeting. We do a high quality MRI. We look at the knee, and X-ray is not going to cut it. It's not enough information. Although an orthopedic surgeon might often do a joint replacement based alone on an X-ray. We get a very high quality MRI with some additional sequences we order off the secret menu. So it's not just a regular old MRI. It's specialized. Doesn't cost more, but it's specialized. And then from that, we can target the actual metabolic changes in the cells that make cartilage. And what happens is the cells that make and maintain cartilage in the old growth plate just aren't working anymore. That's our target. We can sometimes see that right on MRI. And we have examples where we've injected those areas with stem cell derived exosomes and have had significant improvement in function and reduced pain. And in some cases, we do an MRI a year and a half later just to see what, out of curiosity for those that want to do it. And we've actually shown some enhancement in the thickness of the cartilage in a knee. And knees are the low-hanging fruit. Most of the research is in knees. Why? It's just an often affected joint. But we've addressed ankles and hips and thumbs and shoulders and elbows and what have you.
The way I look at it is, when somebody comes to me and they're like, I'm bone on bone, and from my pharmacological perspective, like we've treated with all the pain stuff, we've treated with the anti-inflammatories, we've even gone to pain creams and things that we specialize in, the supplements and the lifestyle. And then all of a sudden it's people's mindset goes, replace, get out, replace. And so I asked them, I say, have you heard of regenerative medicine? Right. Like,
yeah.
And it's kind of like, it's 5-10 years ago, it'd be like, that's where the athletes went to Europe to do their thing so they could play longer. Right. That, and right. Now it's moving in that direction. So yeah, I think the low hanging fruit is definitely, the body, the appendages, if you will. But how is this evolving? Because I want to get into your new practice and ReCELLebrate, and like, let's talk a little bit about cancer therapies, because this is what lit me up when we were talking, because I had just done an episode on exosomes and how they can help and all this other stuff. And then all of a sudden I was like, hold on a second. This is something new to me in a way, right? In this way. And so talk to people about how the back surgeon got into cancer treatment, because it feels a little left fieldy, right?
No, it's not. It's really not. Listen, I'm a practicing neurosurgeon. I've always treated brain tumors and spine cancer and things like that. Not a lot, but I have. And, when you're drawing from this molecular biology and you really want to help people, you really want to tap into the Hippocratic Oath about relieving suffering. You can't not look at cancer as this horrific disease that is potentially fatal and needs to have aggressive and modern approaches and alternatives that are better than what we have, because and there's a role for chemotherapy and maybe radiation and things like that, and surgery even. But let's face it, chemotherapy, is basically trying to poison the cancer faster than you poison yourself, right? So if we have alternatives that don't have that side effect, that don't have all the other loss of hair, nausea, vomiting, loss of muscle mass, loss of weight, all those things, and we can get a result, or we can augment the benefits of chemotherapy, or help the body recover in between bouts of chemotherapy, we may be onto something here. So I couldn't not look at this. So looking at exosomes more detailed, and I might want to insert a question here, and that's why exosomes and not stem cells. And the reason is exosomes are doing the work. They penetrate tissue better than stem cells. They really are the business end of stem cells, and they're about a third of the cost. So it should be, why not exosomes, right? So in using generic stem cell derived exosomes, this is basically the most powerful natural anti-inflammatory out there. And you start to combine it with other plant derived anti-inflammatories, curcumin and others. You're really in our wheelhouse now. That's what we're doing. And there are many ways we make sure people are optimized in their lifestyle, their hormones, everything for this. But you look at cancer, and there are different ways our body helps fight cancer. So since we're tapping back into nature, let's go full circle here on the cancer side. So for those at home, there's a system of the immune system involving white blood cells. And white blood cells, are triggered by the immune system. They fight infection, they fight cancer. And a very small percentage of our white blood cells are called NK cells, or natural killer cells. And I know it sounds like the title for a horror movie or something, but really these cells, their sole job is to identify and selectively remove abnormal cells. So, what are those abnormal cells? Well, they are either dysfunctional cells for some reason, like a genetic accident. And some of those cells could be what are called senescent cells. They're basically old, used up cells leaking a bunch of yucky, you know, peptides into our system, taking up resources, but not contributing. They're not useful anymore, but they haven't died and been recycled. Some people call those zombie cells. And then some of these abnormal cells with genetic accidents become cancer cells, right? We make these all the time. We make accidental genetic cancer cells in our body, but our NK cells remove them.
Right.
They edit them out. They're like a surveillance system. It's only when the NK system functions decrease and the cancer evades those surveillance that an actual cancer problem occurs, a tumor, a cancer diagnosis, a disease. So we have, and I didn't come up with this. I just study like crazy. I read a lot of journals, and I said, hey, these natural killer cells are cool. How do they work? Well, it turns out they work by, just like stem cells, they give off exosomes. Their exosomes have a couple of enzymes in them that go into a recipient cell selectively and cause that cell to rupture, where we can recycle the parts. So we can remove senescent cells. Think about just removing senescent cells. You remove these aged, yucky cells from your population of cells, and therefore you end up with a younger population of cells. So an early study with natural killer cells was to give them to people, and their age-related biomarkers went down in age. So they I think it was beta galactosidase enzyme they were looking, which is, I guess, common in, if I'm quoting it right, in senescent cells. They were able to reduce the senescent cell population. When you do that, you have a healthier person. Healthier people live longer. So you're basically fostering longevity. Well, what if you could use this for cancer? So I'm not the first one to think of this. Other people have taken both NK cells, natural killer cells, and or NK exosomes, because really they're the business end of the NK cells, and use them to inject into tumors, into tumor cell cultures, into animal models, and now humans. So the beauty of these things is they travel well throughout the bloodstream. They also can be injected into an actual tumor, and they are small enough to, get around through the matrix of the in between the cells. And these are now strategies that have been around in the world. And I've been trying to get these for a couple of years, and probably about 4 months ago, we finally were able to get some of these NK cell exosomes. They're very difficult to, you have to, think about it, it's only a small percentage of the immune system. And then from there, you got to collect the exosomes and concentrate them. So it's difficult. So we get them from Europe. They're available in China and Europe. But you have to know where to find them. And so we now have some here in the US. I don't know if other people have the NK exosomes or not. I think you mentioned someone off the recording that may. And it's one of those, the kids like to use in the text, if you know, you know. So
Yeah.
if you know, you know. So we have NK exosomes. We are giving them to different people in different situations, both IV, both injectable. And I don't know if I told you, we're building a state-of-the-art injection center in our practice, where we will have 3D imaging and be able to get these almost anywhere where they need to get in the body. So we are working on that right now. But we have them as a strategy to either help suppress the concept of circulating cancer. Let's say you're at high risk, you have a family history, or you're in remission, you've been treated, you want to stay in remission. Maybe it's something you do strategically. Maybe you do it in between cycles of chemotherapy to help support things. Maybe you do it in addition to, because maybe you don't want to get metastases, and there are probably some circulating cells, around your body that you want to remove. That's what we're looking at doing strategically.
I love that. Yeah, I think it's important to understand. Part of this is like, we're already doing what the body's naturally doing, right? We're mimicking it's mimicry, right? But
Sure.
we're putting it into almost like the way I see it is like we're moving it the pathway because the balance is off, right? This is the premise
Right.
of functional regenerative medicine is we're putting in
Right.
the good signals, we're taking out the bad ones.
Right.
And it makes sense. I love that this is the business end of the natural. Like you took stem cell and then natural killer, and then you went down to what are they actually doing and what are they and getting it down to this exosome. So we're at the very cutting edge of moving this forward. Is there any particular, this is my curiosity coming from a cancer perspective and things like that. Are you seeing, I don't want to like claims, but I want to like, are you seeing the application fit certain types of cancers better than others, or is it just because it's IV, because they naturally know where to grow, right? You just talked about it. It's like these they search and destroy the bad guys, but they don't go looking for what's already working. They already naturally have that ability, right? This is the beauty of the body, of the nature. And so I'm just curious on that respect. Or do you just
Yeah,
see it?
they're selective, but the studies are broadly across many different types of cancer types. It's not been tested on all cancer types, but the vast majority of cancer types are you put them in cell culture and you throw some NK cells in there. The NK cells will go get them. So we're taking advantage of that knowledge and we're just applying it, you know, almost compassionately, even though we don't have full studies on everything yet. We want to help give people every chance they have of a remission, a cure, a life.
Yeah, and I think that's also super noble and super powerful because, I've always said to encourage, empower, and enhance somebody's well-being through education, through awareness, and have people make their own informed, confident decisions about their own health, right? This isn't dictating, you're not diagnosing and saying you need this. This is just opening their awareness up, telling them that these are viable options. There's a beauty and essence to the Hippocratic oath here too, of the do no harm, right? Of like actually doing things that are encouraging the body to get rid of the bad stuff without the unnecessary um side effects or effects that these other treatments. So
Right.
it's not, and I love how we're framing this up as like enhancements, right? These are not things that you have to do, but they, even people going through therapies and doing, because we've been around the block a few times because most of these new novel drug pharma therapies are all targeting some level of an immune response, right?
Right.
So why
Right.
not? And I just like hearing the ads drives me nuts on TV. It's like this, and you could die and you could get the cancer that we're treating if we give you this. And
Yeah.
I'm coming from this space of like that there's so many better ways now, looking at PEMF mats and like putting someone in and helping the body do what it's supposed to do and what it wants to do is, to me, just my
Yep.
personal opinion and experience, seems like a better, safer, more effective route.
Yeah. 100%
So
with you on that. All of the augmentative anti-inflammatory approaches, we do. It's not just the NK exosomes with a high dose vitamin C, maybe a course of ivermectin and febendazole, uh, you know, hot sauna, exercise. All of these things are anti-cancer, and we foster all of them as based on the individual's abilities and what have you.
yeah, and I think that's what I love about how you're messaging all this is it's not like I just think people are just so focused on like not the pill for the ill, but like the new thing. Like, oh, let me just do that thing, it's gonna fix me. It's like, no, you got to get your stress under control. You've got to do the things like saunas and all the thing, treat your body right, put the right food in you, like everything all matters. And I think
Right.
there's not one way, but there's a formula, right? And so I think this is just an added tool that's super important and super inspiring for me because I feel like we're moving out of the medieval stages of cancer treatment and targeting the right things and allowing the body to go and do this thing. We're like just scratching the surface of the golden age. So I'm really excited for that. So let's talk about ReCELLebrate in this new paradigm. Like, is this the new practice? Is this what you're bringing into the fold here? Tell everyone about ReCELLebrate.
Well, I mean, I have just fallen in love with this kind of thing. Alternative, functional, integrative, natural things. I've gone back and opened my eyes to so many things that wasn't part of my medical education, my medical school, my residency, my practice. We didn't talk about these things. Yeah, we had a 1-hour lecture maybe on vitamins, and if you don't get enough vitamin D, you'll get rickets. Well, that might be the definition of a deficiency, but what's the definition of optimization, right? So the Kool-Aid, I stopped drinking the Kool-Aid, let's put it that way, because medicine is really this sick care driven, financially driven system, right? And if you're sick and you're starting to cost your insurance company money, they start to deny stuff, make it difficult for you. They want you to go away. So it's there's such conflict of interest with the payers that I needed to get away from that as well. It just wasn't serving my patients well. And it pits the patient against the doctor. The patients think it's the doctor's problem. The insurance is not approving things, right? Or the doctor's fault.
Yeah.
So we had to get out of that because we need to get back to basics. We're here to help people. Hippocrates set it forth. We need to do it just that way. Even if we are butting our heads up against regulations and things like that, we need to do that carefully and cautiously, and always have informed consent. And ReCELLebrate was all about doing it right. Looking at people, their lifestyle, their diet, their sleep, everything, and slowing their inflammation, slowing down the aging process of their cells, and using regenerative medicine as a tool. And we started out with just the stem cell derived exosomes and joint health and spine health, and now we're doing, and we're looking at people with inflammatory problems and autoimmune and Lyme's disease, recovering from an injury, brain injury, heart attack, stroke. We even now have a nasal spray of exosomes that do penetrate into the brain readily, that we're seeing benefits in the autistic population, better behavior, more attention. So there's an inflammatory component there. People with long COVID, we're seeing some benefits there. We have people with chronic bronchitis who are stuck on oxygen. We've done breathing treatments with exosomes and have them get off the oxygen, become oxygen independent again, back to regular oxygen, the regular oxygen we all share, not a tank of oxygen. And things like that. It's just rewarding, and I just enjoy the work better.
Yeah, very much the synergy that I have. I've been calling it a sick care model for so long, not because it's a derogatory statement, but it really is. It's a reactive model. We're keeping people less sick. We're not keeping them healthy, and we're not proactively treating them to become healthy and well, and now transform and heal. Because I really feel like that's where we are in our medicine and where we're going. And so I love hanging out with other healthcare, well-care practitioners that are kind of like leading the charge, if you will, and moving people and not waiting for the whole payer system to come, right? It's like, if we have to take charge of proactive care, well, we can't go into the reactive care model and expect it to get paid for. We're on the cusp of that, but we're not there yet. And so I really love the fact that we're the providers that feel compelled, right, and want to help people truly, and we're going outside the box. We're figuring these things out as we go. It's to me, the pharmacy of the future is right inside of us. It's like the pharmacist of the future doesn't need to dispense the drugs. They just need to show the patient that they can do it themselves. And here's one example. We've gone through other examples of the mind, and I've got a study right here on magnesium, and there's a reason 30% of people get better off nothing. It's called the placebo, but let's nurture what the heck that means and actually help people do that themselves rather than, just washing it out and have the pharma study say we did it, they didn't, and it's like we've forgot that 30% of people can actually do it themselves, and that's pretty cool to me. So that's where I like to play and what I like to do. So, you know, what excites you the most about the future of longevity science and natural cancer treatments? What's next?
Well, I think that I might have to take those two separately, but
Sure.
listen, longevity is all about slowing inflammation and
Yeah.
the area under the curve. Area under the curve means the earlier you start and the more you do towards this goal, the better result you'll get. So you talk about the super longevity people and the radical life extension people. You're going to have to get involved in this, as a teen and learn it. It's going to be part of your health class in junior high school, and you have to apply it. And the funny thing is, it's no different than what your grandmother was taught, right? It's eat healthy, sleep right,
The lifestyle medicine tools, right? They're the
yeah.
same.
I mean, it's like there's nothing new here. We just have ignored it for too long because we've been drinking this sick care system Kool-Aid crap, and we just need to get back to that, and then we can get back to it at an enhanced level, and removing the crap from our food supply and improving the meat and the vegetables and the fruits we have. And I should put a slight plug in for this. I know food is medicine, and plants are medicine. In the exosome field, we have been working very hard to source some concentrated plant-derived exosomes. So there are a bunch of fruits that are known to be more anti-aging than others. We've actually sourced some organic fruits, and we have a lab in Italy that's extracting and concentrating the exosomes. This is laborious. This is not simple. And we now are about to launch, probably later this month, fingers crossed, a plant-derived exosome capsule, because you can get exosomes in your food. You can get it from bone broth, colostrum, even milk has some exosomes. You can get it from bone marrow. You can get it probably chicken soup. Why does your grandmother make you chicken soup when you're sick? Because it's probably she didn't know it, but it has exosomes in it.
Right. Yeah. Yeah.
So plant-derived fruits and vegetables have exosomes. In any event, we're going to be releasing a daily 1 capsule supplement that'll probably have the equivalent of about 70 times that volume of fruit you have to eat to get the exosomes, the phytonutrients, and the mRNAs in these exosomes are amazing. Plus, plant exosomes are slightly different. They can actually survive the gastrointestinal tract. They have different fats and molecules in their bilipid membrane that makes them survive it. So there is incredible research on this. I just wrote an article for a magazine on it, and the health and wellness benefits, the reduced reactive oxygen species measured, which means less oxidation, less inflammation, the enhanced sirtuin-1 gene transcription. That is an anti-aging gene. You may know it's the one that resveratrol in grapes stimulates. Why people say, oh, drink a little red wine because it's good for you. It's an anti-aging, gives you the resveratrol. It's the same gene activation there, the sirtuins. So that's coming soon. So keep your eyes open.
Yeah, because I love the phytonutrient and then bringing it down to the exosomes. Like it's just,
Yeah.
I feel like that's the pathway. Like super cool. So, all right, well, we'll do a bonus before we leave. You're known as the stem cell whisperer. So tell me how the story behind that nickname.
Yeah, I had a patient. We actually, it was a patient, sweet elder woman with osteoarthritis and aches and pains throughout her body. She couldn't do her crafts anymore. I think she was 79 when we first met. We did some IV stem cell derived exosomes, and I explained to her these will activate your cells, your stem cells, and we call it stem cell activation. And she said, "Well, you're just the stem cell whisperer, aren't you?" And she did great for 2 years. she had improvement in her aches and pains before she came back to ask for another one.
I love that. I love that. So, um, it's ReCELLebrate.com, right? That's how people can find you. You're on Instagram, you're on TikTok, you're on YouTube. What's the handles that people can look for you?
It's ReCELLebrate everywhere you go. ReCELLebrate. If you search that term, I think we're the only people using it with that spelling. So anywhere you find us, it's any social media platform or online. That's where we are. We have lots of resources on the website. And if you're interested in talking or you want more information, there's a little put in your name and email address, and we'll on the website we'll get right back to you.
I love that. ReCELLebrate.com and all the different handles. I always love these last questions. Like, thank you so much for coming on, by the way. This has been amazing.
Oh, thank you.
What's the one thing you want people to know out of this conversation?
There are alternatives to the surgery you may have been offered, the pill you may have been offered, the limited list you may have been offered. And if you are interested in regenerative medicine or just stem cells in general, you don't have to know all these words like exosomes. Ask your doctor, is there a stem cell option? If you are shut down, it might be the wrong doctor. You need to meet a second opinion. It's okay to get a second opinion, even if you love your doctor. It's okay. What we learned so many years ago in medical school has changed. And, unless you go seek it, it's not going to be given to you in a re-education.
I love ending with that because, if we want our people to understand that the doctor's willing to learn and understand other things, right? We want them to know that it's not a one size fits all. And I think getting second and third opinions, if I hadn't got a second opinion, I would not have gotten my treatment diagnosis because I was misdiagnosed. So it's not that we're wrong or right. So I love that you brought that up as a nice package around this. Well, Dr. Jeff, I'm excited because I've got a whole rabbit hole to go down here now and figure out and move through because, cancer treatments and therapies and helping this community is really dear and true to my heart. So thank you so much for all you're doing, pioneering this new pathway and the essence of bringing in all that ancient wisdom into this modern science, which is the essence of this podcast, which is the essence of how I think medicine should go and is going, is we're not forgetting these simple things that you can do around your lifestyle, and we're incorporating the latest and greatest and less harming modalities that are actually doing true healing in the world. So thank you so much for all you're doing.
Thank you so much. I enjoy it and look forward to next time we talk, bringing you something new and even better.
Awesome. I can't wait. This is a wrap, guys. Until next time, stay well. Thanks for joining me today on Beyond the Pills. If our mission to deprescribe 10 million unnecessary medications resonates with you, share this episode, subscribe, and leave a review. Whether you're a practitioner or someone ready to reclaim your health, visit rx2wellness.com for free resources to begin your journey. Together, let's go beyond the pills and co-create a world of vibrant health and true healing. Until next time, live better and stay well.